The main thing is eyebrow height and whether you need to have your eyebrows increased and by how much. And that's where you're kind of deciding about Botox for surgery. When it comes to here, sometimes patients can get little platysmal bands. So they're little lines that go vertically like this. And in the beginning, you can, as they kind of start popping up, you can inject small amounts of Botox in them, and it relaxes that muscle and it kind of recedes into your neck and you don't see the lines as much. Hey guys, it's Dr. Samir Undavia from NJ ENT and Facial Plastic Surgery. And we get this question a lot. We talk about it a lot with our patients, and it's, should I get Botox or should I get surgery? And the answer is complicated. And so I want to go through each of the uses and see which one's better and tell you when you should maybe get surgery and when you should use Botox. And by the way, when I talk about Botox, I don't just mean Botox. I mean all of the neurotoxins. So there's Botox, Dysport, Jeuveau, Zomin, there's Daxxify. We use all of them. Daxxify is new and it's the one that lasts the longest, but in general, they're all neurotoxins, and their job is to prevent your nerve from communicating with your muscle to make it contract and to give you wrinkles. So we're trying to paralyze the muscle where we put it in so that your skin stays smooth in that area. So in order to kind of figure out if you should use Botox or surgery, we have to look at the place where we're kind of using the Botox and then see what the effect is that you want and see whether a surgery or Botox is better. So in general, and this isn't a hard rule, but it's a general rule, Botox is used from here up. And then there's also a little bit of an indication here and a little bit of an indication here. I'm mainly going to talk about here and a little bit of here because I don't think this is that widely used. So let's go from top down. And so for the forehead, if you're looking at wrinkles like I have here and you want to just smooth out those wrinkles, you're looking at Botox. Botox is by far the best way to take care of those wrinkles. The one thing you have to be aware of is that your forehead muscle, which is called the frontalis, is constantly lifting up your eyebrows. So if you're someone like me that's always doing this, lifting up their eyebrows, and you paralyze them, you're going to have a heavier brow. So you're either going to counteract that or you're going to accept a heavier brow or you're not going to do Botox. So for me, I tried Botox. I didn't do it anywhere else. And I realized how much I lift up my brow and my brows came down to about here. I didn't like it. So I am not going to use Botox on my forehead that much anymore. I might use it a little bit here and there, but really not significantly. But if you want to smooth out the lines, Botox is the way to go. You just have to be aware that it might lower your brow. So when it comes to raising your eyebrow, if that's what you want to have done, you also can use Botox to an extent. So Botox to raise your eyebrow is not placed above your eyebrow. It's placed under your eyebrow. And it's typically placed right here where your orbicularis oculi come, that muscle that kind of squeezes down your eye. You're relaxing it and it brings up your eyebrow. So it'll bring up this lateral portion of your eyebrows nicely. You can also put it in the glabella right here. And these two muscles here will also relax to elevate your brow. So you can elevate your brow by putting Botox here and underneath right here. And that will get you some elevation to an extent. Now, if you want more elevation, then you're talking about doing either a temporal facelift or a forehead lift. And so that's when surgery might come into play. And so Botox might help you up to a certain time period. And then as the aging process continues, you might then need to have surgery. Let's say that you wanted to get rid of the hooding on your eyelid skin here. Again, you probably want to do Botox right here in your crow's feet, and it will smooth out this area, by the way, and it will raise your brow a little bit and it'll stretch out the skin. And so you might be able to get rid of that hooding that's on your upper eyelid skin. Now, again, that will be to a certain extent. And after a while, you can't get any more stretch on that skin and you'll have to do something called a blepharoplasty. And a blepharoplasty is where, at least for the upper eyelids, where you take out the excessive skin. For the lower eyelids, we can put some Botox here as well as maybe a few drops right here, and it can get rid of some of the fine lines that happen right there. And to an extent, it can also help relax some of those wrinkles. But if you have excess skin that's causing that wrinkles, ultimately, you may also need a lower eyelid blepharoplasty. So those are the main kind of things we're kind of keeping in track with. The main thing is eyebrow height and whether you need to have your eyebrows increased and by how much. And that's when you're kind of deciding about Botox for surgery. When it comes to here, sometimes patients can get little platysmal bands. So they're little lines that go vertically like this. And in the beginning, you can, as they kind of start popping up, you can inject small amounts of Botox in them, and it relaxes that muscle and it kind of recedes into your neck, and you don't see the lines as much. So that looks quite nice. It's just as the aging process continues and you see them more and you have more skin hanging down, at that point, they're not going to help that much, and then you will need a neck. So I hope that helps.